What is dissociative identity disorder? Dissociative identity disorder, D.I.D., known as multiple personality disorder before 1994, is characterized by the experience of alternate identities that function independently of one another. Each alter, as they are called, often has their own memories, behaviors, and expressions. People switch from alter to alter on a rather personal timeline. However, while transitioning between identities, a person may experience excessive blinking, changes in posture, or trance-like behaviors. The origin of this disease is unknown. However, studies link D.I.D. to traumatic exposure, particularly before the age of 5. The hypothesis is that at young ages, our identity or sense of self is still vulnerable and changing, allowing adverse experiences to potentially fragment it. Globally, about 1.5% of the population is diagnosed with D.I.D. However, this may not be fully representative, because the disorder is often misdiagnosed and requires several assessments just to evaluate if an individual meets the criteria. These include the questionnaires such as the Dissociative Experience Scale and the Difficulties in Emotion Regulation Scale. Each survey uniquely identifies consistencies between the DSM and personal experiences to provide the medical professional with more information to help their patient. However, like many of you may know, no one survey can truly capture the experience of D.I.D. Let's jump into discussing the symptoms these tests look for.
The first quantitative measure in diagnosing D.I.D, the Dissociative Experiences Scale, evaluates symptoms such as the absorption of external stimuli, imaginative involvement, depersonalization, derealization, and amnesia. Meanwhile, the Difficulties in Emotional Regulation Scale examines challenges in goal-directed behavior, impulsivity, emotional reactivity, and self-regulation. These assessments highlight core symptoms of D.I.D, including memory disruptions, identity fragmentation, and difficulties in emotional regulation. Emotional instability and difficulty managing stress are also common, further complicating daily functioning and interpersonal relationships. While these may highlight experiences that individuals with D.I.D have, they also have their limitations. Take Encina and Sammy in the following videos.
What are those?
These are babies.
What's your favorite animal?
I like my kitty cat.
What's your cat's name?
I squeeze.
Oh, Squish.
Hi, I'm Sammy, and I'm the host of a dissociative disorder system. Dissociative identity disorder. It involves forming of independent alters. Almost all alters form out of trauma, as well as daily amnesia. So going from one alter to another, it's like you woke up and you have no idea where you are sometimes. I have always had these people that take care of me in my head. I actually was told I had schizophrenia. I was like, this is not what's happening, and nobody was listening. I was multiple people. I've been in a system of 8 alters for almost a year now. I have 8 different handwritings.
Their experiences could not be more different, yet they both fall under the same diagnosis. Lastly, those diagnosed with D.I.D are at a greater risk for self-harm behaviors and suicidal ideation. Due to this, safety planning is a critical part of the treatment plan and often the first element that a healthcare provider will discuss. If you are ever having feelings of suicidal ideation or just need someone to chat with, call 1-800-950-NAMI. Providers at the National Alliance on Mental Health, or NAMI, have specialized training in dissociative disorders so they can best support your needs.
So if diagnosed, what should we do? D.I.D treatment requires a careful and informed approach. Studies on the general population have found that D.I.D has a prevalence rate ranging from 1% to 3%. One major obstacle in treating D.I.D, however, is the difficulty in finding clinicians who are both well-educated about the disorder and free from bias. Research has also shown that only about 6% of individuals diagnosed with D.I.D display their symptoms in an ongoing and overt manner. Instead, many experience only brief windows of diagnosability, when clinicians are better able to recognize dissociative symptoms and determine appropriate interventions. Contrary to common media portrayals, most individuals with D.I.D do not exhibit clearly distinct alternate identities. Instead, they typically present with a complex blend of dissociative and post-traumatic stress symptoms, often intertwined with seemingly unrelated psychological or physical complaints. As one study noted, D.I.D. usually presents as a polysymptomatic mixture of dissociative and post-traumatic stress disorder symptoms that are embedded in a matrix of ostensibly non-trauma related symptoms. Because these presentations are subtle or misinterpreted, many clinicians may diagnose only the comorbid conditions, such as depression, anxiety, or somatic disorders, without recognizing the underlying dissociative pathology. And this could lead to years of ineffective treatment. We recommend consulting www.psychologytoday.com for an up-to-date list on healthcare providers experienced in D.I.D.
The portrayal of dissociative identity disorder in the media plays a crucial role in spreading awareness and information to the masses. However, it's equally important to acknowledge the widespread misinformation, especially on social media platforms. Destigmatizing this disorder is essential to help individuals with D.I.D. feel safe seeking treatment and support. Whether you know a loved one with D.I.D., you're seeking help yourself, or you're simply looking to educate yourself on the disorder, here's what we've gathered. YouTube appears to be the most reliable platform, with over half of YouTube videos being classified as useful. In contrast, TikTok exhibited a notably lower percentage of useful content. Only about 5.15% of videos were deemed informative or useful. When consuming any media, make sure to evaluate the credibility of the content. Always ensure that the information is based on peer-reviewed articles or comes directly from qualified healthcare professionals.
Portrayals of D.I.D. in movies or television shows are often exaggerated or inaccurate. Movies like Split, Identity, Fight Club, and Hereditary are popular examples. These depictions perpetuate stereotypes, frequently representing individuals with D.I.D. as violent or criminal. In reality, research has shown that very few patients with D.I.D. engage in criminal behavior. We encourage you to be a critical consumer of media by following our tips. We also challenge you to share your own stories via #MyDIDstory. Together, we can change the false narratives surrounding D.I.D. in the media and set the stage for more inclusive and compassionate representations of dissociative disorders. To connect with the D.I.D. community, join our Patreon at D.I.D Story. For more help, contact these suicide and crisis hotline numbers. Let's change the face of D.I.D., one #MyDIDstory at a time.